You've all had questions about sleep, and we're here to help you find them. Dr. Sunny Pandita with the Sleep and Lung Clinic of Utah is an expert in sleep medicine. I'm Jordan Bradford, and this is Healthy Lifestyles, Rest and Distress.
There is no one magic number of the number of hours one should get. For most average adults, most experts feel that between 7 and 9 hours of sleep are adequate. Each person probably needs to figure for himself or herself of what is ideal sleep duration for them. And the way to do that is to sometimes increase or decrease the number of hours they sleep and see how they feel. If you are sleeping a little bit more and then it makes you feel more refreshed, more functional, more productive during the day, then your body is needing a longer duration of sleep. And the same thing can be done with cutting back an hour or so of your sleep and seeing how you feel the next day. If you feel tired and groggy and sleepy, then that shorter duration of sleep is not ideal for you. Sleep definitely is impacted by age. When young kids definitely need more sleep, anywhere from 12 to 14 hours. And again, starting from infancy on, the number of hours you typically should sleep changes. As we grow into our teenage years, our sleep pattern may change, and we still require between 8 and 10 hours of sleep. As our age changes to an elderly age group, the sleep duration typically requirement of sleep is about the same, but how we get that duration of sleep may be different, because most elderly tend to sleep in blocks. They may get 4 or 5 hours of sleep at night, then they may take a nap, 1 or 2 naps during the daytime for 1 or 2 hours. And even though the total duration of sleep of 7 to 9 hours typically stays the same even in elderly. Each person needs to find the best comfortable position for himself or herself. However, generally speaking, we roll over from one position to another during the night. We never maintain one same position throughout the night. That would be hard on our joints. Temperature is a big part of getting good night's sleep. Generally, we recommend a temperature of around 65 to 67 degrees is ideal for sleep. We feel that when we look at natural body rhythms, that as the night progresses, our deepest phase of sleep is when the temperature is the lowest. And that's what we try and promote in terms of if we have to control the temperature of the room to be able to do that. You should not sweat, or you should not be shivering also. If you're shivering, that's not conducive to sleep, or if you're sweating, that's also not conducive. The relationship between sleep and stress and anxiety, or depression for that matter, is a two-way street. When we do not get proper sleep, that worsens anxiety, that can lead to stress because you are more anxious and groggy and not productive during the day, and that can flare up, workplace stress, and it can obviously hamper day-to-day working environment. On the other hand, stress itself can be a detrimental effect on your sleep. You may not be able to sleep properly if you're stressed. The same thing goes for depression. We feel insomnia as well as too much sleep are actually recognized symptoms of depression. So that's one thing which people should be careful about, to have themselves checked, make sure that they do not have a psychiatric disorder like depression or anxiety, which needs to be treated independently, not just be treated in terms of sleep, but that needs to be treated so that they are getting better sleep and their depression or anxiety is treated. We feel exercise and sleep are both important for your maintaining a healthy lifestyle, but one should not be at the cost of the other. You should get enough sleep and then find some additional time in your day to exercise. we feel that at least several hours of gap should be maintained between when you exercise and when you go to bed. There is more and more evidence to suggest that sleep plays a significant role in metabolism and our ability to use or utilize insulin to keep our metabolism and body sugar levels in normal range. When we do not get adequate sleep, the level of stress hormones in our body tends to stay higher, and that in turn makes it harder for insulin to be effective, and that in turn makes it harder to utilize the sugars in our body, and then that can lead to weight gain. Sleeping should not be an afterthought. Sleeping is an active part of your daily routine. It is a lot of normal body functions happen during sleep. It's not a waste of time. It's very productive for your normal day-to-day functioning. Your brain needs to get the rest to be able to function. If you skip consistently on sleep, your ability to be productive, your ability to maintain good health will be affected, which in turn will affect your work, or all the things you want to do will in the long run be affected by that. So it's very, very critical that you are able to spend enough time sleeping.